Emphysema is a form of chronic lung disease due to damage to the alveoli or air sacs in the lungs. The alveoli are located deep in our lungs at the ends of the bronchial tubes. They look like bunches of grapes. The alveoli are where oxygen and carbon dioxide are exchanged.
What happens is you have those bunches of grapes, or the alveoli where the gas is exchanged, the oxygen comes in, the carbon dioxide goes out. And emphysema just means, another name for it, we say in pulmonary respiratory medicine, is destructive lung disease. And what that means is that those bunches of grapes start dissolving. They kind of start disappearing. The body destroys it, really as a reaction to inhalation of any kind of toxic substance.
Alpha-1 antitrypsin deficiency, air pollution, genetics, cystic fibrosis, bronchiectasis, and some rare forms of bullous lung diseases can cause emphysema. But the most common cause in the Western world is tobacco smoking-related emphysema. When you inhale irritants, they travel to the alveoli just as oxygen would. Once there, irritants do what irritants do best. They irritate.
It's the white blood cells go into that area, and they think they get overstimulated, and they start releasing substances that are designed to get rid of those toxic substances. The white blood cell spills out an acid or an enzyme, and it is trying to remove the toxic substance, but in doing that, it creates collateral damage. And once tissue becomes damaged, it's subject to infection, and then because of these recurrent infections that set in, you get more white blood cells, more attempts to get rid of the now bacteria and viruses, and more collateral damage, and eventually creates a self-perpetuating scenario of infection, body defense, collateral damage, more infection, and eventually the substances, which are called enzymes, that are released, as well as, they call them oxygen radicals, but they create acids in the body, and those oxygen radicals and those enzymes are agents that can damage good tissue as well as fighting these bacteria.
This damage weakens and eventually ruptures the walls of the alveoli. Instead of a bunch of grapes, you now have a glob of grape. That reduces the surface area of the lungs, thereby reducing the space in which oxygen can enter the bloodstream and ultimately creating a bottleneck of oxygen. On exhale, the old air becomes trapped, further blocking incoming oxygen. That creates the primary symptom, shortness of breath. But unfortunately, that symptom crops up at a time in our lives when we expect to lose breathing capacity.
A lot of people think, for example, that they're not breathing very well, or they can't do the activities they usually do because of aging or weight gain, or they have a sedentary lifestyle, when in fact they have actual difficulty moving air in and especially out of the lungs.
Diagnosing emphysema requires a series of pulmonary function tests coupled with a medical history of symptoms. There are many treatment options for emphysema. Your doctor will determine the best course of treatment based on the severity of the disease.
We try to treat with a number of drugs that open the airways and reduce inflammation. They're called either bronchodilators, which just open the airways, or anti-inflammatories, which often are inhaled steroids. So people get afraid of the term steroid, but it's always a risk-benefit judgment. The use of the steroids to reduce inflammation, reduce that scarring and progression of damage to the lung is probably beneficial in most patients. Remember, exercise and diet are very, very important. The use of these respiratory exercise programs become very, very important in encouraging patients to be either in a formal or, if not, an informal exercise program. In people who are unable to maintain enough oxygen, we give them oxygen therapy. You see some people, unfortunately, walking around with oxygen tanks, but that will keep them alive and functioning, doing what they want to do for much longer. And of course, we get into immunization. In rare instances, lung transplantation or surgery to pop those balloons, sometimes you get these big balloons developing in the lung that crowd out the normal lung tissue. The surgeon can go in and reduce those balloons surgically, but that's an unusual step.
The number one thing you can do to either prevent emphysema or reduce the effects of emphysema if you already have it is to avoid smoking.
We do have lots of smoking cessation programs. Cigarette smoke is very addictive. It's supposed to be more addictive than heroin, but there are effective treatments now for smoking cessation. We try to encourage people to use multimodality, be it group support, drug therapy, individual counseling, other treatments that can be used, some of them not traditional medicine, whatever works, but we know that multimodality therapy can help people to kick the cigarette habit.
The more severe the disease at the time of detection, the more likely it's going to require lifelong therapy. So if you can't imagine yourself doing all the things you love with an oxygen tank at your side 24/7, it's time to put down the cigarette. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.